The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. I appreciate you taking time out of your day to join me to talk about the changes coming for billing for children's residential services. For those of you who don't recognize my voice, my name is Julie Harrison, and I am part of the Office of DD Services. I specifically work in the operations unit, and part of my job, one of the primary focuses of my job is helping all our external partners, agency providers, and other partners use the express payment system, which is why we're here today. So we're going to talk about changes coming to children's residential services, of which everybody, I hope, on the webinar today is a provider of that service, the changes coming in, the changes to the billing process as a result of those service changes. So let's just jump in and get going here. First, let's talk about what is changing. So as a part of the ODDS Compass and rate restructuring projects that have been ongoing for some time now and are still working on a lot of things, the policy team has made some changes to the DD Children's Residential Group Home Services. And those changes include, for service dates beginning January 1st, 2021, DD Children's Residential Group Home Services will be a daily service. Right now it's a monthly service, and we're moving that to a daily service. And with that changeover, we're migrating all the authorizations for children's residential services into the Express Plan of Care module. So as a part of that transition to a daily service and moving things into Plan of Care, the authorizations into Plan of Care, that will change how providers, you will bill for those days the service was provided. And so we're going to talk about the changes for service dates beginning January 1st going forward. If you still have billings to do for services provided prior to the 1st of January, then you would use the current process that you do now to bill for those services. Your ability to bill for services before January 1st is not going away. You'll still be able to do that, so you'd use that process. The process I'm going to review for you with you guys today is a new process that takes effect for services provided starting January 1st going forward. So a daily service, what does this really mean? So right now, children's residential services are authorized in a client prior authorization, or CPA, as a monthly service with a monthly rate. And then how much you get paid that month is prorated by the number of days in that month that you bill. You bill 100% of the days of the month, you get paid 100% of the monthly rate. Moving to a daily service, that rate and unit of service becomes daily, and that daily rate is established based on the child's Oregon Needs Assessment Service Group and the license capacity for the group home where the child lives. And so Express has been enhanced to capture these other data elements to calculate and pull back the appropriate daily rate that applies for that child. Now, the daily service rate and structure allows payment to the providers for children's residential services to be paid for 344 days out of 365 days of service. So the new daily rate structure is using and assuming a full year of service, a full 365-day year of service. And so you would get paid for that full year of service over 344 days. And this allows you to have, or the child to have, up to 21 absence days per year to equal that 365 days in a service year. And the count for that 344 days that you'd get actual payment begins on the individual's plan of care start date, which will eventually line up with their ISP start date. And so knowing that we're doing this transition to a daily service for children's residential services in the middle of a year, and it could be in the middle of the individual's ISP year in some cases. Some children for this first year, as we transition into this, you may actually be paid more than 344 days in that first year because of the shortened plans of care, because we're making a transition possibly for some children in the middle of their ISP. And so once that you could only have 6 months of the ISP that we're transitioning into. And then when their plan of care ISP restarts again for the next year, that 344-day count will restart for that child. What about if the child moves? So if the child moves to a new group home site, but with the same agency provider, they're just changing houses, they're not leaving you as an organization, then that 344-day count continues uninterrupted. But if the child moves to a group home site with a new agency provider, they completely close out of services with one agency and move and enroll in services with a completely different agency, then that 344-day count resets for that new provider. What's not changing? Well, it seems fairly obvious, but I'll make the comment anyway. But the level of services and supports to be provided to the child, as outlined in their ONA assessment and their individual support plan and all of that other information that's gathered every year to define the level of service and supports the child's going to get in your program, that's not changing. All of that planning process and the level of services and supports that you'd be providing is not changing. In addition to that, your payments will continue to be adjusted or reduced for any client liability amounts that must be paid to you by the child's representative payee at the beginning of each month. I'm not sure that there are kiddos that have a client liability, but if they do, then your payment would be reduced by that amount, and that's an amount you need to be paid from their payee. In addition to that, your payments will still continue to be adjusted or reduced if you have provider liability amounts that are owed by you as an agency. So your children's residential claims are still impacted by provider liability recovery. And the child's representative payee will still pay you, the provider, the monthly room and board that's due for the child to live in one of your group home sites. So all of that's not changing. That's all staying the same. So what is changing in Express for this? Well, the service codes that are used for this service in Express are changing. And it's really only the modifier that's changing to designate and differentiate between the monthly service and the daily service. So the monthly service you see authorized using the code combinations of service element or SE142, ORCGH, which is Oregon Child's Group Home, all. So that would be the codes that would be referenced on your monthly services with a monthly rate. SE142, ORCGH, NA. NA is the new modifier that we're using and implemented in Plan of Care when we moved the service in over there to Plan of Care as a daily children's residential service. And the authorization type is changing. The monthly children's services remains in a client prior authorization or CPA. And again, those aren't going away. Those are still valid for the dates that they're applicable. You can still bill for those dates. If you have like billings for December that you still need to submit for payment, you can use the current process. You're doing that to receive payment for December. That's not changing or going away. But for your daily service authorizations for services beginning January 1st going forward, will be authorized in a Plan of Care service prior authorization or SPA. So children in your program will have a combination of authorizations. They'll have a CPA for the monthly service up through the end of December, 12/31/2020. And then they should, if they're continuing with your program, they would have a service prior authorization or SPA that starts January 1st going forward. So you could see two different authorizations in the system now for those kiddos. The service prior authorization, or SPA, for children's residential will look a little bit different than the CPA. First off, the rate that's authorized on that SPA will show in a different location. And that's because with the daily rate structure, the rate is fixed as opposed to being a range, and not to exceed limit range. And so where you find that fixed rate on the authorization is in a little bit different location. And I will show you how to find that here in just a few minutes. And how you bill for daily children's residential services will also be different. Initially, starting in January, providers are only going to be able to bill for each child individually. I do appreciate that this is kind of will make things a little tedious and slow the process down a bit, but to meet our timelines, that was the functionality that we were able to get into the system. And the ability to bill for multiple children at one time, similar to what you use with the CPA now. We hope to implement that structure for the daily SPA billing in the future. But initially, you'll have to bill by each child separately, and again, that's part of the demonstration I'll show you guys in just a few minutes. You will still create claims for payment. Right now, when you're billing against a client prior monthly CPA for residential services, you're putting in a direct claim as opposed to a service delivered billing entry for POC services. Even though daily children's residential services are moving into plan of care to be authorized, they will not have service delivered billing entries. You'll continue to create direct claims for payment for the residential service. They'll just be a daily claim as opposed to a monthly claim. A bit more about the claiming process. Like I said earlier, if you need to claim for service dates prior to the 1st of January, you're going to continue to use your current claiming process for billing against a client prior authorization, or CPA, that you've used in the past. Like I said, that process is not going away. It's still available to you if you have billing still left to do for dates prior to the 1st of January. But to bill for those daily residential services for service dates starting January 1st and after, you're going to use a new claiming process for those authorizations. So it's really the types of claims and the process you use is based on the type of authorization that is in place for those service dates. So billing for daily children's residential services against that service prior authorization, or SPA, you're going to continue as a provider to bill for all the days that the child was enrolled with your agency, including, so you're going to bill for the days the service was received by the child, and these will generate payment for up to 344 days per ISP POC full year. Payable days that are greater than 344 days will suspend, and the reason that you'll see on those is a maximum daily billing dates reached. So assuming that the child is not absent from your service at all, if you bill 100% for a full year and the child has no absence days, the days 345 through 366 days will suspend, because you've already been paid for the full year in the first 344 days that you've claimed. But those additional days that potentially could be paid but exceed that 344 payable day limit will suspend for that reason showing here in blue, maximum billing days reached. And the nice thing is that these claims will remain available to potentially replace a claim that was paid within that 344 day limit that maybe had to be voided later, so to help reduce any financial impact to you as a provider. In addition to billing for those days the service was actually received by the child and provided by you, you're going to report the days the child was absent from service, but still enrolled with your agency and still enrolled in that placement. And these absence days are informational reporting only and will not generate a payment. Against a CPA, the rate structure is different. So those absence claims, like for a family visit or vacation or whatnot, those actually generated payment for you against the CPA. Moving into the POC service prior authorization with the daily rate, those absence payments are factored into the 344 days that you're actually paid. So when you report an absence for a child, you're just telling us that they're absent from service and telling us why. Those absence claims that report that information will not pay because the other 344 days have factored in those absence days that you potentially could have with the child because they're going to visit family or whatnot. When billing for children's residential services, even though it's a daily claim, you do not have to bill by individual date. January 1st, January 2nd, January 3rd. You still can claim for a date range like the January 1st through the 31st. Perhaps you're going to bill the beginning of February for the prior month. You can still do a single entry for January 1st through the January 31st. For that child, and then Express, once you've submitted that information, Express will automatically create separate daily claims for each day of service within that date range that you've billed. We do that automatically for you, so you don't have to do 31 individual claims for January. We'll break those up into 31 individual claims for January for you. And using separate daily claims, I think, will help agency providers in two primary ways. One, it'll be easier for you to track how many of those 344 days have been paid for each individual, because you can do a data pull on their claims and you get a list of each individual daily claim, and then you can do some simple math to find out how many of each child's 344 day pay limit have you achieved at whatever point in time you pull the information. So hopefully that will help you quickly see that, as opposed to trying to, okay, 31 days in January and 28 days in February, and trying to do that math and figure that out. This will help you guys manage that and track that a little bit easier. In addition to that, having separate daily claims, if you have a claims correction that you need to do, you can isolate the specific day or days you need to correct without impacting other dates that may have been included in that date range. If you have one claim right now against CPA services, if you bill for an entire month, say the month of December, at one time, and you have one claim for the full month, and then you realize that you needed to do absence claims for a couple days in December because the child went to visit family for the holidays, for example. You need to correct that entire claim for December, which creates a huge provider liability until that new claim comes through and gets processed. If you needed to isolate just 2 days to correct and the new daily claim structure, then you can go specifically to those dates that you need to correct without impacting other dates in the month that don't need to be changed or corrected. And that hopefully will lessen your liability process and recovery in the future. And it'll be easier to track, I just corrected the 3rd and the 4th, as opposed to I had to correct the entire month and then do another one for the entire month. Hopefully daily claims will help you be more precise and be able to really focus in on the pieces that need to be corrected without impacting larger claims or larger amounts of money that have been paid to you. In addition to that, your daily children's residential service claims are going to have new information and data on the claim that may look different than what you're used to seeing on the CPA claims that you've submitted in the past. Moving into the daily rate structure, service structure, there will actually be 2 claim types now for those service prior authorization claims. The first type that you'll see will have a code FFS attached to it, which means fee for service, And this is a regular claim that was or could be paid. And it will show a claim modifier of REG for regular claim. Absence claims will have the type code ABS, which stands for absence. And again, like I said, these are absence claims or informational reporting and don't generate a payment. And then the claim modifier that is associated with that ABS absence claim will be the code that's appropriate for those absence reasons, like family visit, vacation, medical hospitalization, and that you're used to seeing now. In addition to that, absence claims will have a new status. This is new to the system, and that status is reported. And we wanted to differentiate that because absence claims aren't paid, and so we don't want to have a status of approved, because that's associated with claims that are approved for payment. But we did need to give it a new status, so it was really easy to see that the system has recorded and saved that information, and we have it in the system. So it's the status of reported for absence claims is also new. If you have absence claims to bill for dates prior to January 1st, again, that's part of the previous CPA claiming process, and that has not changed. These new claim types and status changes apply to the daily claims that take effect for January 1st going forward. Services provided January 1st, 2021 and onward. If you do need to make a correction to the daily residential claim, the best practice is really just to avoid that incorrect claim. And again, the system will create individual daily claims. So you just find the specific date or days that need to be corrected, and then you can void those and then create a new claim with the correct data if needed. Perhaps it was a paid claim that needs to be actually reported as an absence, so you would void the paid claim and create an absence claim in its place. If there was like, oh, I shouldn't even have billed for that day, and you void it, but you have other claims and that claim you voided was paid, and you have other claims that are suspended for that maximum billing dates reached reason, then those suspended claims can replace the one that was voided to lessen financial impact and basically use up that liability that was created by the claim that was voided that you had been paid for. So, and that process should happen automatically in the system behind the scenes. I don't know that you need to do anything different. We should be able to reprocess those overnight if needed to fill in any gaps that may be there for claims that have been paid to you. So let's see how this all works in Express. Also at the top of the webinar, I forgot to mention, if you have questions, please use the questions option on your control panel, and we'll take a look at questions. I'm going to see if I have any in here. I do have one. Here we go. Let's take a look at some questions, and then I'll demonstrate how this was going to work for you guys. So question about the 21 absence days, is it for a fiscal year or for calendar year? And if fiscal year, since starting January, and we won't see 21 days suspension this year, but would see it in June of 2022. So the absence days for the 21 absence days that apply to the daily residential claims, that limit is within the plan of care dates for the child, which should align with their ISP dates. So we're no longer operating under a fiscal year start marker. Everyone's ISP or plans of care, for transitioning into children's residential services start January 1st. And so it's possible that the 21-day limit for the CPAs and then the 21-day limit for SPAs, there may be you may get more than 21 days because the type of claim that you're submitting and the type of authorization are completely different. And I don't believe that the 21 days of absences for the year crosses that authorization type, claim type boundary. So your 21 absence days calendar starts at the start date of the plan of care for the individual. In this case, everybody's plans of care will start January 1st. Some children will have their plan of care will only be a short period of time. Perhaps their ISP renews in March. And so they would have a short 2-month plan of care for this transition, and then their ISP and everything resets on March 1st for the next year. So once you get to March 1st, then that starts the counter of the 344 days and 21 days for that child's next ISP year that starts March 1st. So as we transition over, and as children get established with their plans of care and authorizations aligning with when their next ISP starts, it's possible for providers to have report more than 21 days in a calendar year, because we're trying to roll into using ISP year. And it's possible that you could get paid more than 344 days in a calendar year because of that transition and rolling into when the child's ISP starts, which starts that 344-day clock again. Other questions about things before we start into the demonstration? I'm not seeing any questions pop up. So let's go ahead and let me show you how this is going to work. I'm using the practice site. So I'm using the Express practice site, which is a clone of Express production, but the data, demonstration data, and the client information, the names have all been redacted for privacy. So you'll see stuff in a general sense, but it should give you an idea of how the process works. And I have some demonstration scenarios set up in here already. So let's just log in, and I'll walk you through the process to find your authorizations and then to bill for those claims for a daily service. And we've time traveled the practice site. I'm able to manipulate the site a bit. So we've time traveled in towards the end of January. So I'll be able to actually demonstrate billing for the first part of January for you. Let me get signed in here in my agency demonstration. There we go. That looked weird. Must have been how my browser was formatted. Okay, so this should look normal to people. If you're getting into the Express desktop, that's what this view is the Express desktop. Everything was there. Now, let's talk about finding your authorizations for the daily services. Under prior authorization, your previous authorizations lived under the CPA, Client Prior Authorization. But for the daily children's residential moving into plan of care, remember I said the authorization type was changing to a service prior authorization. So to find those daily children's residential authorizations, you want to search by the service prior authorization and then find SPA, because that's the type of authorization that the service is using now, starting in January. And the system it's thinking. Well, it takes you to a search page similar to what the CPA search page would be. Hopefully we'll get the system, there we go, to come back. There we go. And then now they've got a lot of options to search to find those authorizations. For the Service Element 42 for the children's residential, the easiest way to find those authorizations for you as an agency probably will be to search by Service Element 142, Children's Residential, And then a date range, you can add a date range to narrow that date range down as we move forward in time. Everything right now starts January 1st, 2021. So I'm going to go out to the end of the biennium and see what we can find, and then click find. And then your results authorizations will show again in the list below, just like you're used to seeing if you're searching for authorizations before. Let me make this a little smaller. You can see the whole thing. There we go. So again, you have the service, the authorization ID number, the individual's prime, their name, the service information, 142 ORCGH NA, just like we talked about. The units is 1 because you're going to bill 1 day a day because it's a daily service. For children's residential, the contract number is the state's kids program contract number, the authorizations date range, and then the provider, and then the group home site where that child is living. You'll see that the rate column says NA, and that is because Daily Children's Residential Services is using the new rate structure, which gives it a fixed rate based on the child's needs assessment, service group, and the capacity for the site that the child is living at. It also allows for exceptional rate add-ons to be included on the plan of care for short period of enhancements. And that information, the authorization of that information is managed by ODDS, but that would increase for those applicable dates that that add-on applies for. The system will increase the amount that you're paid for that particular date. The fixed rate plus the additional $57 for whatever, and that's just an example amount. If the fixed rate is $300, that's the daily rate you get paid. And then if you have an add-on for a period of time for $57 a day, then for the dates that that add-on is applicable, you would get paid $357. And if it's only a couple of months, then once that add-on is over, you go back to being paid that fixed rate of $300 a day. So for the life of the authorization, the daily rate can fluctuate if the child has an add-on for a period of time that's added to that. So since the rate isn't static, it's not the same for the entire date range of the SPA potentially. That's why we can't populate a rate here at this point. But if you wanted to see the rate, you could open the service prior authorization again by clicking on the blue SPA ID number to open that. And this will give you a look at what the authorization looks like too. Okay, this is what the service prior authorization looks like. If you also provide other plan of care services like employment or DSA or something for adults, this should look familiar. You're probably used to seeing it. But down on these fixed rate services, like children's residential group homes and such, you have a section at the bottom of the authorization that is listed, shows rates. And if you expand that section, then you would see what the daily rate is, the fixed daily rate, and the dates that that rate applies to. And then if this child had an add-on for a period of time, then the dates that that add-on is applicable, you'll see the applicable rate that applies for those dates that include the add-on amount. So you'll have a rate history for this authorization found down here, and it can fluctuate over the life of the authorization based on any add-ons that may be added or any capacity changes to the site that the individual is living at. In addition to that, if you click on the prior auth claims section header here, you expand that and you can see the list of the daily claims. I've not claimed against this particular authorization yet, so there's nothing here. But if I did have claims against this authorization, then those would be listed in this section as well. So you can see easily how many days that you've billed for the life of this particular authorization, and then the rate history that applies to that particular authorization. So you can certainly export these results just as you have in the past, but finding out the amount total or the rate, you may have to dig into each authorization to find that, since it could be flexible and it could be different based on the particular date of service and the other features or other add-ons that may be included for the child if they have them. So that's how you find your authorizations. Again, pretty straightforward. Prior authorization, service prior authorization, find SPA brings you to this page. And then to search for those children's residential service authorizations, the easiest way will likely be to search by service element 142. You can add the individual's prime number if you want to find something specific to them, date ranges, a variety of different ways you can search. Of course, this should be familiar to you if you've used it in the past. So once you've found your authorizations and everything looks appropriate, then when services are provided, again, retroactive billing is still in play. We can't bill for the dates in the future because those dates don't exist yet in time. But let's take a look at how you would submit claims for those particular children. So when it comes time to claim for daily children's residential services, you'll want to have the information from your organization or your house manager if they send you that information to do the billing on which dates the child was in the services, and if there's any absence dates that need to be reported for that billing period, and then the type of absence that they have. So of course, you'll need to gather that information from other people in your organization, just like you have in the past. That process probably hasn't changed for you on your end and probably doesn't need to change. But to bill for daily services, children's residential services, since the service authorizations now live within plan of care, you'll start in plan of care, service delivered, create service delivered entries from single authorization. Now, I know that we're not creating service delivered specifically for daily residential services, but this is what gets you to find the authorizations to bill against to take you into the billing page. So I know it may be confusing. Service delivered, we're not doing service delivered. That's true, but you're still going to use the create service delivered entry from single authorization to get to the billing page to bill for your daily children's residential services. And what happens is that you get into a search page to find those daily children's residential services authorizations that are active and ready to be billed against. And again, like I said, the easiest way to find those probably will be just to select service element 142 children's residential from the service element drop down. And then the effective date, end date, this is the date range of the service dates provided. It'll default to the current month like it does now, and you can change and broaden the date range as needed. But we're going to bill for some dates in January, so I'll leave those dates the way they are and click Find. And again, now you get the list of all the children with your agency that are authorized and have authorizations for the daily children's residential group home services activated and ready to bill against. And so to bill, it's very similar to billing for other plan of care services, only when you click, so you're going to use the $ at the far right like you have in the past for plan of care services. However, that $ takes you to a claims page as opposed to the SD billing page. So that's the difference here. Because the children's group home services does not require a service delivered billing entry, when you click on the $, it takes you directly to the claims page to enter the claims for the service. And this may look similar to the absence claim page that you're used to using in the past. We built this to be very similar in nature. But for this individual, and you have to bill each individual separately. At this time, we hope to have a mass billing available in the future. But you would enter the first service date, And then you can do multiple date segments. So for in this case, let's say that this individual um, received service in January, from January 1st through the 10th. Okay. And then I need to add more dates. So I would just click on the add button to bring back another row. And then they went home to visit family on the 11th and the 12th. Not 11, there we go. One January 11th to January 12th. And so since these dates I know are an absence segment, that I'm going to check the box that says absent, telling me that they were absent from service for these 2 days. And checking that box activates a reason drop-down menu, and then I can select the reason why were they absent. Oh, they went to visit family. So I'm going to select family visit. I still have more dates to enter for the month of January, so I'm going to click add, and I'm going to bring back January 13th, 20, who's when the child came back to the house, and I can bill through the rest of the end of, towards the end of the month. It's the 29th on the here. I'm going to bill through the 28th just to make sure it goes through. So now I have my dates, and you can see I used a date range. I didn't have to individual one, first, second, third. You can do that if you want, but you don't have to. You can use a date range. And it allows you to add additional rows for additional date segments that you need. It allows you to isolate specific dates that are absent on the same page and then tell us which absence, which type of absence they had for those days. And with all that, once you have everything entered that you need, then you click continue, and Express is going to now create your draft claims based off this information that you just entered. And it may take, because I'm going to get 28 individual, see, now I got 28 individual claims. Express broke those apart for me. Okay, and you can see that each claim is for a single day of service, and the rate is the single day of service. It's a regular claim or family visit. That's the modifier because these are absence claims. And you see under here, claim type, fee for service, or absence claim. It gives you all of that information. So if all of this looks good, you can click submit, or you can leave them in draft and then come back and find your draft claims as a batch and submit everything all at once. So let's submit these. And says it's going to take about 4 minutes. So we may have to check back later to see if we can find what the results of those claims. So while that's processing, and we're in the practice site, so it may take a bit, I'm going to jump over and look at some more questions here. Question here, the OAR 411-325-0490 allows providers to bill a regular service day when the individual is out of the home by meeting the criteria listed, meaning you're provided up to 8 hours of support that day. Maybe they left to visit family in the afternoon and you supported them for the majority of the day. I think that's as a scenario that would fit that example. I assume we are billing those as fee-for-service regular days, correct? Just checking there is no new different process to track those in Express. That's a really good question. I will take that back and confirm. My understanding is if by rule or ODDS policy, if you're allowed, if that is considered a regular claim, you provided service within the parameters of how that's defined, then you would bill that as a regular day. That is my understanding. But I will actually take that question back to the policy team at ODDS and make sure that that's accurate or get a clarification if I am inaccurate in that information. Question, can I pull a SPA report via Excel from Express also to get the rate that way? Unfortunately, you can, well, fortunately, you can pull. Let me come back to that question. My submission process was processed, some claims denied. I may have duplicate claims in there. Some other claims approved, and you can see the results of that once it's submitted. Or you can always check back later once you submit that you don't have to sit and wait. But this question around the service prior authorizations, let's take a look at that. So, oops, authorization, service prior authorization, find SPA. So you certainly can export this list of service prior authorizations by using the export options up here, just like you have been able to in the past. That's good news. Unfortunately, once you export them, the rate field will continue to list NA. And so in order to get the rate for that SPA, you're going to have to go in and look at each individual service prior authorization to find the rate. And then that may still not give you the accurate information that you need because of the difference. You may have a different rate. This, for example, this first authorization is a 5-month authorization, and you could have several different daily rates, excuse me, that are in effect for that date range period, perhaps because the individual child had add-ons for exceptional rate enhancements for short periods of time for a variety of reasons that would be approved over the life of that authorization. And so the base rate of what was the one we saw earlier, $722 a day, may not apply to every day of that authorization, which is why we put it as NA. We don't have a static rate that applies to 100% of the authorization, potentially. So that would be something you would have to look at the rate history and see if there are any rate adjustments or enhancements that apply to the history of that authorization, and then do some math that way. So really we're moving, it's a paradigm shift, and I understand that's going to be kind of difficult for providers to adjust to, especially since you may have your own internal accounting processes set up one way, and now Express is shifting the focus. We're really kind of moving away from dollar amounts to units of service. And so that's kind of the shift that we're making with the rate structure, fixed rate structure, looking at the units of service for the individual, and then the rate is auto-filled based on the individual support needs as opposed to a negotiated or calculated dollar amount to serve that individual. So there may be some adjustments that providers have to make as we work our way down this path towards implementing these new fixed rates as a part of that rate restructuring project. It's probably not the answer you wanted, but unfortunately, I think it's the best way I can explain it at this point. Okay. So once you've submitted your claims, you can come back in later and find those claims if you want to, just like you have been able to in the past. From the left-hand menu, go to claims and then search or update claims. That allows you to find claims or make corrections to claims if needed. Again, in the big claims search page, lots of options to search by. Again, the easiest method to search for your daily children's residential claims will be to probably search by service element 142. You can search by prime number for a specific individual if you like. Again, date range, whatever. As you add different criteria, then the search results will get more specific as you search. So let's go 20. Let's just look for the first 15 days of January and see what we find here. I want to max display all because I like them all on one page. It's thinking. Well, as it finishes that, you can see here, get this all on one page here, That below you get your claims. The claims, we've added some data columns. Oops. Sorry about that. There we go. We've added some data columns to, and we've updated this. Let's look at approved claims. Let me change that. Approved. There we go. So we have the claim number, the client information, the service information, the provider information, the date, the claim date. And so again, for 142 daily, each claim is a single date, as you see here. The amount that was billed on that claim, if you had any reductions due to client liability, the claim paid amount, and again, if you've had any further deductions because of provider liability, and then the net payment that you received for that claim. And then the status, meaning approved, of course, means that you'll receive the money. So this may be a good place also to get information on the daily rate that you need. Unfortunately, it doesn't help you before you submit the claim, but each claim will tell you how much was actually paid against that claim. And this total can vary. It can be the fixed rate itself or the fixed rate plus any add-on amount that was applicable for the date of the claim. And again, this claims list is exportable just like they have been in the past. Let's look at this particular prime number. There we go. And if you search by individual prime over a date range, since each date is an individual claim, this might be a good way to, you can check for a year, for 6 months, for a quarter, and then export the data, sort it by client, individual, and then you can kind of gauge by the number of claims that you have over that period of time, by the claim type, fee for service or ABS would be absence. Then you can get an idea of where you are for that particular individual per their ISP year, how they are doing, and how things are going and getting your 344 claims billed and paid back to you. That may take some adjustment to work with in your own system, so you may want to think about that. Since the move to daily services for children's residential, and we're moving into plan of care with these enhanced features, including that 344-day limit aligning with the individual's plan of care start date, which will eventually become their ISP start date after we transition everybody through. We're moving away from the fiscal year for everybody as we move into putting these residential services with the fixed rates into plan of care. And so the 344-day timer that starts may be different for each child living in your program because each child has a different ISP start date potentially. It's not going to be the same date for everybody. So that may take some adjustment, or you may want to chew on that when you get back to your office about if you need to make any adjustments in your own systems to track that per child in your own systems. And again, this is all new, and we understand that it's new, and it may take some time for you to get used to using the new process for your services, and then seeing what information Express has, what information do you need in your systems potentially, and then how the two can you can get information out of Express to support the processes you have in your internal accounting systems. So I understand this may take some time to adjust as we go through. But children's residential is the first move into that daily service fixed rate for residential care at that 344-day billing limit. That's essentially what I wanted to show you in terms of how to find your authorizations, how to claim for children's residential services for each child that you have in your program, and then how to find those claims and again export that data. Are there other questions that people have that I can answer before I let you all go? Not seeing any come up. So moving on then, if you do have questions, and here come a couple, so I will take a look at those then. If there is an error in the rate or address, who should we contact? Great question. If you have, let me get back to Express here. If when you bill for services, there we go. Stop this. There we go. If you bill for services for an individual, or you look at an authorization and you look at the rate and that rate doesn't seem appropriate for you, in this case it is, if you open the claim, I'm going to drill down to the authorization and then I can open the authorization directly from the claim. If looking at the authorization, this rate doesn't seem right to you or appropriate to you, then I would contact the state kids office and have a conversation with them. For children's group home services that are in Planet Care, the daily children's residential services, using the fixed daily rate, that daily rate is derived from the rate schedule that has been approved through as part of our rate restructuring project. And then each service group, needs assessment, Oregon needs assessment service group has an associated daily rate for this specific service. And so it would be, and then that rate changes based on the licensed capacity for the site that the child is living at. So this rate, the daily rate that's assigned for an individual is based on their O&A assessment, the service group and the service group resulting out of that assessment, and then the bed capacity for the group home site where they're living. And so those things are fairly static. And so there really shouldn't be rate questions, I would hope, because the rates are fixed and they're actually auto-populated back into the authorization and onto the claims from the rate tables. So there's less chance of, oh, I transposed the numbers when I typed it in and then having to go back and make those questions. But if a rate doesn't look appropriate to you, then you may want to have a conversation about the service group for the individual as a part of the assessment. And so you would talk to probably the service coordinator or the assessor around that assessment that was completed that generated that service group result for the child. And if your group home is licensed with a capacity of 4 and it should be 3, and then that is something that you would want to address with the office, the DD office licensing office, around adjustments to the licensed capacity for the particular site, if that's a problem. And then again, if a child has an exception that is generated as a result of their O&A assessment, then there could be an add-on for an exceptional rate, excuse me, for a period of time. And then that additional add-on amount would also show here in the rate history. So if you have questions, it depends on what type of question of the rate is. If you don't think the assessment is accurate, then you would pursue those avenues. If you have questions about assessments that have been completed, if you have a licensing capacity issue with your home, it needs to be adjusted, then you could pursue that as well. And then if those things get corrected, then the system would then correct the rates as appropriate. If the individual service group gets changed or the capacity gets changed, then the rate gets automatically adjusted and things will be reprocessed. On the remittance files, will claims come in via single days? Yes, they will likely. They're individual claims, and so on the reports, you will see them as individual single day claims. Can you review the ISP somehow within the Express system? The ISP potentially might be added to the child's plan of care, but the plan of care as a whole is not something that agency providers have permissions to view, because there's other information in a plan of care that you may not be privy to that involve other providers, and so those permissions are fairly restrictive. If you need ISP information around when does this person's ISP start or when it's going to end and whatnot, that would be a question that you would want to take back to the individual service coordinator, either at the kids res team or the county, probably the kids res team. So the rate for the client looks like it's in a different license capacity than what we have. That would be something that you would want to take a look at. I will see about putting together. I don't have it put together right now, but I need to update the residential rate matrix. I have one for resident groups, service element 50 adult group homes. I'll need to create one now, a rate matrix document for children's residential that I can share with you all, so you can see what the service group is, and then the capacity, and then what that daily fixed rate would be, so you have that for reference. But if you have, I think it breaks from 1 to 3 capacity, a capacity of 4, a capacity of 5, I think is the highest level. So if you have a site that you think should be capacity 3 and you have it and it's listed in Express as capacity 4, then you could contact a licensing department and we can see about getting that adjusted for you if needed. We just need to know which site it is and what's the capacity you believe that it should be listed as. Should there be a big difference in rate for kids in the same house? It's possible, because each child's rate is derived from their own Oregon needs assessment. And so you could have, 3 children in a group home, and one has a service group of 1, and the other has a service group of 3, and the third has a service group of 5. And so each of those rates are going to be different, even for the same capacity home, because it's based on the individual's assessed needs and the service group that need resulted in, that assessment resulted in for the child. So it's very possible that you would have a different rates. A big difference. I think they could be a couple $100 perhaps a day difference. Again, I'll have to get that rate matrix updated, and I'll send that out to you so you can see how those daily rates break down. Great question. I just was saying that. Do you know if the kids rate table will be available in the help section Express like the adults DSA rate? It will be soon. I have to put it together, but I will email it all to everybody ahead of time, so you have it available before I'm able to get it up on the help menu. It may take a little bit for me to get it onto the help menu, but I will get it up there as quickly as I can. But it definitely will email it to folks so you have it on hand, even though it may not be on the help menu for a little bit. So yeah, I'll get that out to you folks. Other questions? One thing I want to definitely let folks know is when you bill for daily residential services, you're only able to bill, just like your CPA services, against authorizations that are in accepted status. So if you go to bill for a child, Plan of care, service delivered, create service delivered. You come in here, you search by service element 142. And you look for the children in your home, and perhaps you should have, there's 4 children listed here. Perhaps your home has 5 children. And you're like, uh-oh, where's child number 5? This page, remember, is only showing you authorizations that are in accepted status, that are active, and can be billed and claimed against. So if there's a child not listed here, that means that their authorization isn't activated yet. So it's possible that the kids res team is still working on getting that authorization put into place, or there's the child's eligibility held it up. I mean, all those other validation rules that applied for client prior authorizations also apply to the plan of care service prior authorizations for daily kids res services. So it's possible that it could take a little bit for an authorization to get activated for you. But just like the client prior authorizations, once the authorization is active, you're able to bill retroactively back to the begin date of that particular authorization. So if this authorization here on the first row, say it didn't get submitted and activated in the system until January 7th, on January 8th, the provider could go in and bill for service dates all the way back to the 1st of January if needed. So you can bill retroactively back to the start date of the authorization, but only to the start date of that particular authorization. And you may end up having, like this second person, their authorization ends the end of March. Looks like they probably have an ISP that renews April 1st. And so once that gets done, you'd have a second authorization listed that started 4/1/2021 going forward. Again, just like CPAs, you may have multiple authorizations for different date ranges of service dates that apply. Alrighty. So if you have other questions that come in around the rate process or how this all works for you, we have resources available to you, and many of those I'm going to email you later today. I do have 2 new user guides for you all to assist you in billing for daily children's residential services, as well as finding your authorizations. And so those are ready to go, and I'll email those to you guys shortly after we get done with this session. So I'm going to try to, and I'll put those on the help menu as soon as I can, but I want you to have them hard copy in hand, or like electronic copy at least. So come January 1st, on the first part of January, you want to start billing, you have the resources available to walk you through that process. Also, if you run into problems and you need assistance, don't hesitate to submit a technical assistance request form inside Express and letting us know you need assistance. We definitely appreciate you using the technical assistance request form process as opposed to just emailing someone at ODDS that related to Express issues, because this allows us to track if there's a system issue we need to address, or if there's a larger training issue that I need to address. And so that gets tracked through that request process that you submitted. And then if you have questions related to the daily rate structure, as a part of the ONA, Burns and Associates rate work that has been happened, or ODDS policy or OAR questions, or other Compass project related questions or issues, you can send those to the email listed here, odds.questions@dhsoha.state.or.us. And then someone from the policy unit will hopefully be able to respond and assist you or connect you with the person that has the answer for your question. And that's really all I had to share with you all today. I do appreciate your time very much. This is a pretty significant change to our service structure. We're excited about it because I think it's going to really make things a lot when we get fully implemented over the next year or so. It'll really make things a lot easier for providers, especially as stuff is auto-filled, reduces rate errors because of transposing numbers or miskeying something. But we definitely are excited about hopefully these positive changes that are coming. We do understand it's going to be an adjustment, and so don't hesitate to reach out to the resources that you have available. If you have questions or issues, we'll do everything we can to help you through the process. I will hold a bit. Does anybody else have any other questions to come through on the questions panel if needed? Happy to take those if you do. I'm not seeing anything come through. Well, in absence of any additional questions that you may have, like I said, that's all I had to share with you today. I say thank you, and I appreciate all the work that you do every day, especially in extra specially difficult times with the pandemic, but it's much appreciated, and so thank you very much. I hope everybody has a fabulous new year. Please take care. Bye.